Okay, so we're recording now, seeing as nobody said that they objected to that. So we did usually at the beginning to do an icebreaker, which we kind of don't need to do, but we sort of thought it's a fun thing because it's got a little bit of education in it as well. So I want those of you who are there as couples just to take a shoe off each. Actually, you'll need to take both off and give your partner one of your shoes and you keep one of your shoes. Okay, does that make sense? So each of you should end up with, just say it was Sally and me.
Yep.
I would have a shoe of Sally's, she would have a shoe of mine, and we each have a shoe of our own. And then the next thing that you do, we'll just show you, you turn back to back like this, okay? And then we ask you a series of questions and you put up the shoe that you think answers the question. So this will be the first one. I haven't taken my shoe off yet, Sally. So I'm just going to put my hand up because it'll take too long. So who's going to change the nappies? And so let's just say that Sally puts up my shoe and I put up Sally's shoe. Perhaps there's an issue that needs to be discussed. So that's often the case, is one thinks that the other one is going to decide. If it's both, you can put both up, but try and be a bit creative. It's a fun thing to do. So we'll just tag team with a few questions.
Yes.
So you can start, Sal.
All right. So who's going to get up in the middle of the night to the crying baby?
Ooh.
Jenny.
Okay. Who's going to decide what this baby's going to be named?
Which football team is this baby going to follow?
Okay, who gets to decide which side of the family, if any, you're going to celebrate Christmas with? That can cause some tension.
Yes, definitely. Who's going to change most of these nappies?
Mm-hmm. For example, name. Okay, let's move on a little further till the baby's now 4.5 years old and it's time to think about school. Who's going to get to decide which school? One of you might have gone to Grey Street. The other one might have gone to George Street. You each think your school rocked, if you both came from here, that is. So who's going to make that decision about where they're going to go to school? They're a little bit down the track.
Yes. I haven't started running some questions.
I should have written some down.
You got any more, Jenny?
Oh, well, let's just do a simple one. Who gets to decide, I know, whether you're going to know the sex or not?
Yes.
This might have already happened.
That's
but some people, the father really, really, really wants and feels like he needs to know, but the mother doesn't, and she's there in the ultrasound and, yeah, can cause a little bit of tension. So anyway, that's probably enough for our, hopefully you're all warmed up there. Write some questions about whether you have any other ideas.
Yes, and give us some feedback of who won what, or,
what areas of conflict.
Yes.
Yeah.
So now we're going to go through signs of labour. So all things that you'll all go through hopefully at one point during this pregnancy. Do we flip to the next slide and then?
Yeah.
Yep. Thanks, Bianca. So early signs of labour. So you might get some abdominal cramping, sort of like period pains. Not everyone suffers period like cramps or anything though, but they can be quite uncomfortable, or you might not even really notice that stuff's happening at all too much. Sort of like cramps, and also those cramps can radiate into your back. And so some people get a lot more back pain depending on where your baby's facing during these early signs of labour. And some people just feel a little bit off, just not quite right. and yeah, you start changing. You can get a show. We might describe it as a bloody show, but it could be, it's sort of a plug of mucus that you might wipe on toilet paper or you might see on your underwear. And this mucus can have a streak of blood or bright or dark red blood in it. And it can happen during these early signs of labour, or it can even happen a week before labour is about to start as well. So, and sometimes happens after if we need to do a vaginal examination, something like that.
Sometimes even after sex, but don't worry about it. It's not something that you really particularly need to ring your midwife about, although you might mention it to her when you see her next, or you might, want to talk about it. That's fine. Please don't ring us at 2 o'clock in the morning to say you've had a show, because without contractions, it really doesn't mean that you're about to go into full-on labour. It's not like the movies. It's not anywhere near as fast, and it's not usually anywhere near as dramatic. It's usually quite elongated, and even call the midwife, which is very good. It doesn't really, because it's a show, it doesn't pertain to how quickly things unfold. They do 2 pushes and the baby's out. It's not like that. And rupturing the membranes and the next thing they're pushing, it's not like that. So do you want to go on?
Yeah, so a nesting instinct might kick in. So that's where you might be starting to clean your house, making sure everything's neat and tidy and ready for this baby, just like animals and stuff do as well. Us humans prepare the home ready for the newborn as well. Some people get some Braxton Hicks, which is sort of like practice contractions. They can occur, like you might have already had some of these during your 3rd trimester of pregnancy. They're irregular, uncomfortable tightenings of the uterus, but they're, as we said, very irregular and will come and go, and then might only hang around for an hour and then disappear and come back 2 days later or something. But they're not regular and really strong contractions that stick around. Some people get nausea and vomiting as well, so your body might be starting to clear itself out a little bit, and that diarrhea as well, to be able to bring bub all the way down in the pelvis. And your body, you might notice an increase in need for carbohydrates to get ready for this marathon that's about to begin. You can get some pelvic pressure as well. As we said, the baby's head's coming down, trying to get all the way down as much as possible without you needing contractions to push baby down. And so, your pelvis is starting to open that bit more up to allow for bub to come down there.
Okay, when to call your midwife. This is really important, so listen up with this. We work very hard, and we love to hear from you, but we want you to be ringing at the appropriate times, and I'm sure you want to know exactly what the appropriate time is as well. You don't want to not ring if you'd needed to, but at the same time you don't want to ring if you didn't need to. So at any stage, if you feel your baby's movements have changed, you all should have been given that brochure on the baby's movements. It's really important to take good notice of that. Most times we check the baby out and everything is absolutely fine, but you don't want to be worried that your baby's not moving, and then there has been a lot of evidence to say that that's can happen, that your baby's actually really unwell and needs to have some attention and perhaps be birthed early if there's something not going right. It doesn't mean that that's happened to your baby at all, but we just need to check it out. So usually you feel a bit concerned because you know that the pattern that you've established, that your baby's always active all day long and then they haven't been active for a long time, it feels to you, several hours, and you're like, hang on a minute, the baby's not moving, that's the time to ring. And or, you know, if it's always busy at night and quieter during the day, but that's your individual baby's movement pattern, then that's when you need to let us know. If you have regular painful contractions, so generally we can tell on the phone with somebody if they're in labour or not, if they're in, you know, getting to established labour by their voice. They ring up, if they can just chit chat and say, yes, I'm having a few, my app tells me it's time to come to hospital. They're great things, those apps, they really are, but they don't tell you all the nuances. Generally, if they're irregular, that means that they haven't settled into a pattern yet, so they're probably not. That could be the pre-labour or early labour, but they're not established labour yet, that it's time to come to hospital. And the longer you can stay at home in your own comfortable environment, but once you become, you know, if you start to feel concerned or worried, you just feel like you need to be checked out, that's absolutely fine. We're a 24-hour-a-day service, and we're always nice to you when you ring. And so that's fine that you can ring any time of the day. We always have the phone sitting, well, I don't put it right next to me, I'll put it in the bathroom, but I hear it, absolutely. I just don't like it right next to me. The other reason that you would ring us would be if your membranes have ruptured. There's, you know, you might feel that warm sensation of, oh my goodness, what's this? And it could be like the movies in the middle of the supermarket, but probably not. Sometimes it's in the bed. Some people will prepare themselves by having something in the bed for just in case, maybe a thick towel under that part where they would get the water coming out. Or it could be just a little trickle and you think, well, what's that? Some people feel like a physical jolt, and then they notice a bit of water or a lot of water, and it's usually clear or pink. We particularly need to know if it's not pink or clear. If it looks yellow or brown or green, they're all could be indicators that that we really do need to check you out. Check baby out, more to the point. And for some people, the rupture of membranes can be quite a late sign, but for some, they have the rupture of membranes and then they go into labour later on, or sometimes we need to help you get into labour if that's happened. So it's something that you might want to talk one-on-one about your midwife with as well. If there's any bleeding, so a little bit of show, we've talked about that, a little streak, you know, a little bit like maybe the very beginning of a period, that much is okay. We don't need to worry about that in late pregnancy. But if it's bleeding that, oh, I need a pad on, it's like I've really got my period, then that's too much and you need to let us know. If the blood is quite bright, that's another indicator that we really need to see you. If you've just had an internal examination that day or maybe the day before and you get a bit of a brown discharge, that's old blood and that's not really to be concerned about, as long as your baby is moving and you're well otherwise. So always at the bottom of that we put, if you're concerned or worried, you are very welcome to ring us.
Yeah. And if you do think you've ruptured your membranes, just making sure you put a pad on. So then if we do get you in, then we can see what's on your pad and what colour it is and that sort of thing as well. Or we might even, say to put a pad on whilst you're at home, and if you get some more fluid on it after an hour's time, that may be a reason. My friend.
Okay. There was just one other little thing that I thought of then while Sally was talking, and that was please ring if you need any advice. Don't text, okay?
Yes.
It's the thing is our phone gets diverted to somebody who's on when we're off, and it's only diverted for phone calls, not for text messages. So I could put, and I do, because we work very hard sometimes, and we turn our phone off and we're very happy to not have to attend to it for a little while. So it can go in the drawer for several days. Most of us are part-time, so it can be a number of days we're not around and we don't pick up on a message, and perhaps it was something important. Besides that, you go back and forth, and it's a little bit, it's just better to ring and check, even if you think it's okay. just ring and check. It's just better to do it that way.
Yep. And then you get your instant answer then too. And obviously due to the coronavirus, the way we get into the hospital has changed slightly. So when you do call, we'll advise how to get in into the hospital. So at the moment, during the day, during the week, you can still come through those front doors, and they will screen you, ask you if you're feeling unwell or not, and take your temperature. Both you and your partner are allowed to come in during labour, or you and your support person. So just yourself and one other. And unfortunately, no visitors during your hospital stay. But that is changing. That could change a month down the track or something. So just bear with us with that one. And then if it's after hours, you need to come through the emergency department, which we usually, if we get a chance, and you're not, to call them and let them know that you're coming in after you've spoken to us, the midwife. So we get you into the hospital, we check your pulse, breathing, do all your observations, and we listen to your baby's heart rate. Depending on if you meet criteria or not, we might have to pop a CTG monitor on you. So that's monitoring baby's heart rate, and with the contractions as well. We put these straps around your belly, but we might not have to put that on. It's a good time to, if you haven't already, to start timing your contractions, and we will do that when we're in, perhaps feeling your belly and looking at our watch or clock on the wall to time how long they're going for and how far apart they are as well. We will often need to do an internal examination, so a vaginal examination, to check to see how far dilated you are. And with the dilation, we also check to see how shortened the cervixes have become as well. So our findings of that, as well as how your contractions are going, tells us how well established your labour is. Okay. Trying to keep calm and stay in control as your body adjusts to this new environment, especially once getting into hospital. Some people really don't like hospitals, and some people do. But we'll try and make the environment as to promote your labour, maybe having it nice and quiet, calm, and dark room, and that also helps with providing that good environment.
And we'll be perhaps pursuing a little bit more of that with our little video. I've just seen a question about will the changes in visiting people be communicated? I think it said. Let's just have a little look. Will the changes to visitors in hospital be communicated to us, or do we need to keep checking? I think given that you're all probably zooming towards the end of your pregnancy, you'll be seeing people fairly frequently. We'll be doing, a number of checks with you, even if they're just phone checks if you've seen the doctor, and that's the environment that we can communicate that with you. I think if it changes, we'll probably all be excitedly getting onto all of the women that we're looking after and saying, guess what, you can have more people now.
Yeah.
So yes, it will be, but you can keep checking in as well.
Yeah.
But let's hope it changes too. Just one other thing about timing your contractions. I did mention earlier that there was an app that you can get. There's a number of apps actually, some you pay for, some are free, and they're quite good, but it's something that it's a really good idea if your birth partner actually does that and you sort of stay in your creative side of your brain, the instinctive primal side of your brain, in order to labour instinctively. We just see some really great examples of women who just get on with the job of going into labour. And so there'll be a lot of information that we give you today, and some of it's sort of a bit medical orientated. Just please take it with a grain of salt, because you know, your labour can be incredibly natural and unfold without you know, interventions and things, and you can just really will keep you safe by a lot of checks, but they don't have to be very invasive. And when you're in that that nice creative sort of side of your brain, you really get to, your body will really go to where it needs to go to. So positions, and we'll encourage you to get upright and move around and things like that. But you know, we're there to encourage you on the side, but we always defer to what you want to do, because it's your body and your baby knows how to get to where it needs to get to, and your body will tell you, move this way, move that way. And it's a wonderful thing when we see women that just believe in their bodies and are able to go into that place where they just do what their body tells them to do. So if you start, you know, being obsessed with your stopwatch, looking at how long the contractions lasted and how long it was since the last one, you're moving out of that creative side of your brain, and perhaps inhibiting that that wonderful natural flow. Yeah, that's the word I'm looking for. Yeah.
And sometimes we get people into hospital and check you out, see that you're in early labour, and sometimes we do need to send you home as well, because we want, studies have been done and you're more likely to progress much more better in your own home environment. So that's why initially when you call on the phone, sometimes we suggest to stay at home, suggest other things to do at home, or sometimes, as I said, we even get you out, get you in, check you out, and then also send you home. So, and that's not a surprise to send people home as well. Yeah. So monitoring your baby during your labour. So not all labours need this. This is what we call a CTG monitoring. So we measure baby's heart rate on that line, and the bottom line is the contractions. The bottom line showing those contractions where the hills are. Just how high the hill goes doesn't mean how strong the contraction is. People get excited about that. But we feel your tummy to feel how strong those contractions are and how you're feeling those contractions as well. So sometimes we need to put this monitor on you, and if you are being induced, as this slide says, we do need to keep this monitor on the whole duration of your labour. And for other reasons in pregnancy, you might need this monitoring on as well. We're very lucky here. We've got plenty, 3 CTG machines, but they all have the wireless capability as well, and that are waterproof too. So you can still have your shower as well, bath with these monitors. And so it doesn't hinder any positions and stuff that you may need to be in. The only thing is sometimes the positions that you're in, we might lose a little bit of contact with baby's heart rate. So there's other things that we can talk about to help get that good position, but we will base that on an individual basis. As well. So this is monitoring your baby's heart rate. Another way we monitor baby's heart rate is via auscultation or the Doppler, which you would have all had that done at your antenatal visits with your midwives, where we just listen to Bub's heart rate for a minute or 2 at a time. And sometimes we just use that throughout labour as well.
Just the progress of labour. First stage of labour, the onset is of painful, regular, like we talked about already, contractions. Some people like to call them surges, not contractions, but we'll just stick with contractions because that's what's written here. But yeah, it's they need to be regular and you should be feeling them. It's not a walk in the park, labour, but it's certainly doable. And one thing that really helped me when I was having a baby was that the doctor said, look at everybody that you see, they've all been born somehow. And, you know, most women over a certain age have given birth, not everybody, but, you know, so yeah, it's a wonderful time, but it's not really, what's the word I'm looking for, an unusual thing to be pregnant and having a baby. The dilation and effacement or thinning of the cervix is what happens in the first stage till it's 4 to 10 centimetres. 10 centimetres is what we call fully dilated. At 4 centimetres, we consider that you're in established labour at that point. The first stage of labour is typically progresses at the rate of about 1 centimetre per hour. Sometimes it's less, sometimes it's more. But as long as you're progressing is the really big key that we're looking for. There's a time of transition at 8 to 10 centimetres, and there's a real difference. Those of you who will be the birth partners will really see this. It's at the point where you just feel like you can't cope anymore. Sometimes you're crying, sometimes you're irrational, saying, I just want to go home, I want to get out of here, I want to stop this labour, dig it out, all of those sort of things. We hear that all the time, but the interesting thing is that it's something that you can get through. You just need some coaching. So this is where the support people, you are incredibly crucial to the birth process. Just recently, I felt like the partner was a coach. I said, you'd be a really good sports coach because every single contraction he just coached her and coached her and coached her. Another one very recently, every single one he just encouraged her. You're doing great, you're doing great, you're doing great. I can't do it anymore. Yes, you can, you are, you're doing great, you're doing great. You cannot hear that often enough, and that's if you just had dead silence as you were saying, I can't do this anymore, you would think, oh, they all agree with me. So it is, you know, it's sometimes hard watching somebody if it's going through it a bit. But I think the really important thing is to try and embrace it and not fight it. If you embrace it, know that it's good pain. It's not pain for no reason. If you had a really nasty car accident and you were just left lying in the middle of the highway with nobody there to comfort you, nobody there to bandage you up or, you know, set the broken bones or give you any pain relief or anything, then it would be just awful, wouldn't it? But this is a creative pain, and if you can work with it and just go with those surges or go with those contractions and let your body do the work and relax in yourself and know that your arms are fine, your legs are fine, your head's fine, hopefully. You know, listen to us when we tell you to relax your shoulders. It's a really important one. When you become a little bit anxious, your shoulders tend to go up around your ears like this and you're all tense and your face, you know, scrunches up. But if you can just learn to unscrunch your face, relax your shoulders and allow that relaxation to flow through your body, you will literally dilate better. Yeah. It relaxes your pelvic floor. It allows your cervix to dilate. And sometimes, you know, there's medication that we can help with that. We'll come on to that shortly, but there's all sorts of things that we can help you get to that end goal of getting this baby out. So don't be concerned if you're having a vomit. We always say, you know, it's not very nice for you to vomit. We go, oh, that's a good sign. Yes. Nausea, that can be at any stage, but we often do see that a vomit comes along as you're progressing, getting really into really strong labour, and that crying, irrational state of mind is something that will pass too. Usually people feel much more in control once they can do something with the pain and start pushing.
So the progress of labour and getting into the second stage. So the second stage is when we've got to that fully dilated point. So that 10 centimetres, you can't push a baby out until we've got to that fully dilated time. And sometimes, especially your first, we like to check you to usually make sure that you've got to that stage. But sometimes we see a baby's head and we know that you're at that stage too. So it's the time to start pushing with being fully dilated, and you only push with those contractions. Okay, so there's no point pushing in between. You use that pain, that contraction, and use it with pushing out your baby. So we do like at least 3 big long pushes during one of your contractions. And so sometimes we have to coach you during that process, or sometimes your body just naturally takes over and you just push out, just like doing a really big poo, and push out your baby as well. So again, depending on if you've had any pain relief or that sort of stuff, we may have to coach you more. But sometimes your body just naturally takes over and needs to push this baby out. This stage can take up to 2 hours, especially being your first baby. All those muscles have never been stretched this much before, but they can do it, but they just take that little bit longer with your first baby as they haven't done that before. And we'll be there to help coach you through this, and or your doctor. Or
it's quite natural to, we get you to start pushing, and it takes a good number of tries before you get it right. And sometimes you can feel despondent, like you're never going to get it. But with a just continual practice, because you're having a contraction every few minutes, with continual practice, continual input, telling you when you're doing it really well, because we can tell from what's going on as we're looking. And then your body really just sort of takes over, and then you really get into it. So don't feel like you can't do it, you can.
Yeah. This is our pelvis, just a foam one. Anyway, I'm just going to show with my fist sort of what our baby has to do when you are pushing. So Bub's head's coming down, and with that pushing, we'll probably do this in a film when we do our film on next Friday. So with your pushes, Bub's head's got to get around this pelvic bend. And so it takes a little while to get around that pelvic bend. So once we have, then your baby's head tends to sit down around that bend. But it can take a long time, or feel like a long time, to get around that bend and stay sitting there. And your baby's head's got to turn in a manner to be able to fit through there, and the shoulders as well. Then so there comes a point where your baby's head is crowning in the vagina, and there will be a point where the midwife will say to you, breathe, or nice little pushes, and it'll feel like a burning sensation, the ring of fire, some people call it. And that's really important, just to really listen to the midwife or whoever's birthing your baby, and breathe through, or do those little pushes as much as you can, in order for those muscles to stretch enough and hopefully allow no tearing. So I think we'll get to a slide about that too, as well. So we'll talk about tears. I think that's coming up, but then we progress to the 3rd stage of labour after Bub's is born.
So our policy here is to delay the clamping and cutting of the cord. That's been shown to be best for baby, to get that little bit of extra blood while the placenta is still working, and then it separates off. Our policy is also to give oxytocin to reduce bleeding and assist the delivery of the placenta. That is something that you can request to not have, and we'll make sure that you've got plenty of information about that so that you make an informed decision. But it has been shown across the world to reduce the incidence of postpartum hemorrhage massively. So that's why we use it. Then the suturing of any tears or episiotomies that may have occurred happens after the placenta is out. So we use just a little bit of traction on the cord. Our policy is also to invite the birth partner to cut the cord, and then we just go on and deliver the placenta. Usually, maybe 5 minutes. Certainly, usually by 10, it's out. If we've used oxytocin. it's really pretty quick, and then the uterus is able to clamp down to prevent bleeding. They call the type of muscle tissue that the uterus is made of as a living ligature. A ligature being a tying off of a vessel, because it's like a web, and the vessels travel through the web to the placental site, and afterwards with your own oxytocin and the artificial oxytocin, it clamps down, so those vessels naturally just get blocked off, so your bleeding should be controlled. Occasionally we need to give you more medication to make that clamp even further, but generally speaking, it's enough.
So the role of the support person during labour, as Jenny touched on earlier, the role of the support person is quite a big role, and is the only way that a lot of women get through labour as well. It's a team effort in doing this, although the woman does most of the main work. With this support, it helps the labour, and definitely the women need it to help get through. They can aid with pain relief, such as massage, helping position changes, or your partner might know your pain relief options as well, and both you guys might have had a chat about it, and have what pain relief options. Your partner might know what you want, and what your beliefs are around that as well. So the physical support, even going and giving water, giving snacks throughout the day, and encouraging doing that, are big things. Like the same as a marathon runner, it's very handy when you get up to a water station and someone's handing you a drink. That's always very welcomed. And the constant presence of just being there, and especially during this COVID time, it's really great to have that support as well, and that's throughout the time. And that reassurance and just being supportive of that person.
Something that I often say is that the woman needs a set of eyes to focus on, because sometimes you just don't feel strong enough yourself, you don't feel like you can do it, but if you lock eyes with them, and that can be us, but also you're the first one that she'll look towards, but sometimes as things progress, they might need to lock eyes with the midwife or the doctor as well, just to say, you've got this, you can do this, but really that's an incredibly important part of the support person to do that. And there's so many different things you can do with pressure points and massage, and just that and you know yourself whether you like touch or not. Some people really don't respond so much to that, but they need to hear. So it's, if you like it when you're not in labour, you'll probably, like a foot massage or something, you'll probably like it in labour as well. So you'll probably be able to tell what will work. One other thing too, the support person, remind her to go to the toilet as well, because it's really good to keep an empty bladder. And I'm not sure if all of you have heard about the book. It's called Birth Skills by Juju Saunders, and she's a obstetric physiotherapist, has great information, and I really like her approach, because she's certainly not against any pain relief, other pain relief options, but she's got a whole set of things that you can do which focuses in around the different senses. So there's smell, there's music. I think we might touch on that again later. Yeah. So that's a really good book. So Juju Saunders, Birth Skills. We do have a few copies here, but they seem to be getting like hen's teeth. I think they haven't been returned. I'm not sure. I keep forgetting to check out the library, but I know you can buy them quite readily online. So,
So we've got our anaesthetist here. So we're going to get Eve to Dr. Shepherd to present